Welcome to the AUA News Inside Track podcast, an official podcast of the American Urological Association. Thanks for listening. Today's episode is part of the SAU AUA Urology Match Insider series, developed by the Society of Academic Urologists in partnership with the American Urological Association. The SAU AUA Urology Match Insider series provides medical students interested in the field of urology an inside look into the Urology Residency Match process. The Urology Residency Match is owned and governed by the Society of Academic Urologists and administered by the American Urological Association. For more episodes of this podcast, please visit www.auanet.org/podcast.
Welcome to another episode of the AUA News Inside Track podcast. My name is Lola Lozano, and I am currently a sixth-year student at the University of Iowa's Medical Scientist Training Program and current representative for the North Central section of the AUA's Medical Student Membership Work Group. Today, I have the privilege of moderating a discussion on the importance of mentorship in urology. I'm pleased to introduce our two guests, Dr. Adam Weiner, Assistant Professor of Urology at Cedars-Sinai in Los Angeles, and Dr. Sara Lenherr, Associate Professor of Surgery and Program Director for Urology Residency at the University of Utah. Thank you both so much for being with us today and being willing to chat with us and share your thoughts and advice. So to kick us off, can both of you tell us about the most fulfilling mentor-mentee relationship you've experienced in the role of either position?
I start with when I was a mentee, and I think back to one of my earliest mentee-mentor relationships with my mentor in medical school. He was an associate professor of urology. I was just kind of exploring specialties. I had no idea about urology. I just knew that it sounded like he was doing some research I was interested in. He had listed himself on, that long list that medical students get of people who are willing to take on medical students. And so I met with him. I thought we had a good exchange, and then we worked well together. And I truly would not have even thought about urology seriously if it wasn't for that relationship and that person's willingness to put themselves out there to really any medical student that wanted to volunteer their time. There was a big introduction to responsibilities in research and being a part of a team that really the paper really depended on me to get it through the finishing line. And it was that sense of responsibility too, and that person allowing me that ownership of that project to feel like I was a part of something bigger. And I know as I look back and I think about other mentors I've had since then, it really started with that relationship that got me involved in urology and interested in urology.
It's really funny to hear Adam talk. I think we both started at the University of Chicago for medical school, didn't
how about that? Yeah.
We probably had the same types of mentorship relationships there. I stumbled into urology similarly as a medical student there, but I'll reflect on a mentoring relationship that I had with actually a high school mentor that really was my launching pad into medicine. And that was really, she was a mentor who really said, why not? And that's really something that I've carried forward in my mentorship style. I try to be a realist and encourage people to reflect on their own strengths and motivations. But if something seems interesting, I really want to encourage them to explore why it's interesting and say, why not? And follow that gut instinct when you run into something and say, hey, I didn't know about urology, or hey, I didn't know about this research project. Maybe I can tackle this. And so being a mentor for me is really facilitating that why not questioning and encouraging people to follow their hearts.
Fantastic. Thank you. I think a lot of people end up stumbling into urology, and it's great to hear you all share that as well. That was my similar experience where I didn't even know what the specialty was, and did a rotation at the recommendation of a colleague and fell in love with it, as well as the team dynamics and the mentors. And I hear a lot from you both about the importance of ownership and independence and exploring your own interests within that and supporting mentees that way. So thank you. The next question we have is, so we know that mentorship is not a one-size-fits-all. There are formalized mentorship programs versus more informal chats or connections. Why is it important for medical students, especially those interested in urology, to seek out mentorship? And then a little bit more in detail with that is in the context of the Urology Residency Match, why is it important for students to seek out that mentorship early, and how can a mentor assist with that process?
I'll tackle that one first. As the program director, I'll just say that this is a really key thing. You really need to identify one or multiple mentors for the urology match because it is such a complex process. First of all, there's logistical things. There's deadlines and nuance that you really need to get input on. You actually really need to have somebody look at your CV and have honest discussions about your competitiveness for different programs, diversity of regions across the country, types of training programs that you might thrive in, like mentorship models or bigger programs, smaller programs. And you really need to get that input before the whole application process to really work out the kinks. There's so much to gain when you talk to a diverse mentorship. You want to have fellows, residents, faculties, family members all look at your CV, your personal statement, and really ask you those tough questions before you get to the interview process, because you want to stumble through those answers and get there like, no, you bombed that question, or maybe you don't really know what you're talking about answers before you get to the actual match process. Adam, was that kind of your experience?
Absolutely. I think you hit the nail on the head that, well, there isn't one perfect mentor for every medical student, and it's so important to try to reach out to as many folks as possible. And even when I think about the person I was just talking about, who I had a couple year relationship with, that person was great, gave me a lot of guidance, sent emails to folks, and was supportive. But there were other people in the division of urology that were not as familiar with me, but still provided an insight because they were looking at me from a different lens as more of an outsider. And those people, of course, come with kind of their own instincts when it comes to mentoring medical students and giving advice and seeing the annual cycle and the same mistakes that people make every year and trying to correct those. So I completely agree. Reaching out to many people early and often, I guess, is the key.
Great. Yeah, it sounds like it takes a village to raise a urology residency applicant, and that you almost have to have like this pyramid system where you have kind of like a main mentor that can give you that intense feedback, and then also a broader range of people that are also providing that support. Next question is, do you have any advice on how to select a mentor, and what characteristics and/or attributes are most important?
Yeah, sure. So I think there is no perfect mentor, and there are different mentors for a different situation, and you just have to acknowledge that sometimes a certain mentor is not really the right fit for giving you advice on something else. So there's research mentors, there are people who are more like career mentors, there are people who are life mentors who maybe you relate to them on more of a personal level, or your family structure is similar, and that person can give you different advice than someone that you've been publishing abstracts for the AUA on. I think if I had to give you one broad general approach to selecting a mentor, in general, it's nice to go to someone that you look up to, there is something about their career or the way they carry themselves or the way they treat the people in the OR or in the clinics, or some of their achievements, something about that you want to emulate, and go to them for the advice in that category of mentorship. So if it's the research career, talk to them about research and how to apply yourself to that. If it's something related to medical education and you want to grow in that facet, then find somebody who that's their passion. So at least that's what I think is one key when you're looking for mentors, because there's so many to choose from.
I totally agree with Adam. I think that there's so much diversity in mentors that you can have. I feel like the other dynamic of a mentor is to recognize that we're passionate as mentors. We want to help you. And oftentimes we might have a little bit too much skin in the game. And so a true mentor, you really want them to be unbiased and not necessarily make you into a carbon copy of themselves. So it's so true. You want to see a career path and understand how to maybe go through that stepwise. And that might be coaching. But you also need to have a mentor that's not going to be disappointed if you don't necessarily follow in their footsteps. I had a medical student I mentored a couple years ago, and she was deciding between urology and OBGYN. And I was like, this is total, like, why would you pick the other path? But she was really torn and she loved both parts of the career. In the end, I told her, I'm not the one who's getting up at 5 a.m. to go see those patients. You are. You need to determine the thing that brings you that joy and follow that path. And I'm not the one leading your life. So a true mentor is really the one that lets you follow your own path as the mentee without pressure or bias or judgment. And so hopefully those mentors really listen and stimulate reflection on your own path and not necessarily pressure you to be a carbon copy of themselves.
Okay, so it sounds like key features of these mentors are find someone that you look up to and want to emulate some aspect of what it is that they're doing as a urologist, incorporating diversity of mentors for different skills and knowledge, and then, being able to find someone that encourages you to follow your own exploration and interest. Great. All right, so the next question that we have is, as mentors, do you seek out mentees? And if so, what characteristics do you look for and what do you hope to get out of mentoring?
So this is certainly something that we all do at different levels in our practices. I do volunteer my name with regional and local School of Medicine mentorship kind of different platforms. There's also SWU, which is the Society of Women in Urology. And, the main thing is to remember that mentoring is a time of reflection for all of us. So we like this opportunity to pay it forward to the next generation and have them help themselves navigate things in the right direction. The characteristics that I look for mentoring, like for the mentees, I guess that it's mostly that we are going to need to rely on you to really guide the mentoring process a bit. Those of us that are very busy attendings, we want to support you, and it's not a burden for us, but sometimes we have too many other things going on. And so if I tell my students that if they write me and they want to meet and I haven't gotten back to them in a week or two, it's okay to just ping me again. Or if you go back to meet with somebody and they kind of look at you with a blank face about like, what did we meet about last time? Feel entitled to go ahead and say, remember last time we talked about this and I was trying to decide about this aspect of something, a research project or whatever. And so then they give you some context, and we need those crumbs because we can't keep it all in our heads anymore. So definitely try to give us that benefit of a doubt. We want to support you. Sometimes we just need you to be a little bit more proactive in the partnership to have us help you.
As you can guess, I'm newer to the game, and I would say you just put it so perfectly well that I really have to soak in what you just said, because you're absolutely right. Like you as a mentor, you desire a really active mentee, someone that's not going to do the work you're expected to do, but someone that's just going to facilitate it, set up the meetings actively, hit the deadlines, set the deadlines, tell us your goals, remind us what we talked about. And I've recently started to become familiar with, or at least familiarizing my mentees with an approach that, well, they will likely be undertaking something that they are unfamiliar and uncomfortable with. And most of the times, because I mean, by the time they're coming to me, it's not like I'm teaching them a class or a didactic. There isn't like a rubric or a course outline on what to do. So if you're spending several months with me for research, expect that I can't tell you what you're going to be doing day to day and week to week. You have to set those goals for yourself. And it's going to be very likely that you're going to have a period of time where you have no idea, where you feel like you have no idea what you're doing and are you ever going to accomplish anything. But being comfortable with that and is so important as a mentee when you're trying to gain some new knowledge or experience from a mentor. But I do got to say that you're absolutely right, Dr. Lenherr, that if a mentee can take an active role in that relationship, you just feel like you're accomplishing just so much more.
We're only human.
From a mentee's perspective, I think it's incredibly helpful to hear that it's okay to be proactive in that way. I think a lot of times with trainees, the fear of the academic and medical hierarchy can lead to silencing and not wanting to step on toes or to push the faculty too much. So it's really helpful to hear that sort of permission for trainees to have that sort of actionable behavior.
And I do have to say, I think the 1 week rule for nudge emails is what I used to call them. I just kind of started doing that as a medical student, and now I feel like that's a golden rule. If someone hasn't responded in a week, it's totally fine to nudge, and no one is going to be offended about that. I think that's pretty much a golden rule in academia.
And the other thing along with that, just as the rule of not judging somebody if they don't follow exactly in your footsteps, if they have that bias and they're annoyed that you wrote them back, nudge them at a week or two, then they're maybe not the best mentor. They're not necessarily in that role for the right reasons, and you need to have somebody who's going to be able to handle that type of feedback. So
Right. Yeah. I think it also touches on being able to choose a mentor-mentee relationship where you can have that open communication and set those expectations early, but continue to have that dialogue of, things change as you go along. So being able to keep that door open to, okay, how are we going to do better or improve to make sure that we're pushing our goals forward? All right. The next question is, what are some helpful ways to identify and connect with a mentor or mentee? And then with a particular attention to students who don't have a home residency program.
So I thought about this question when you sent it out, Lola, and I think that it is important to kind of take the hints that are out there. So Dr. Lenherr just mentioned something that's really familiar at most medical schools, where a lot of faculty can put their names on a roster where medical students have access to it that basically says, I'm open to taking medical students. And typically these are usually associate professors, sometimes some professors as well who have the infrastructure to accept medical students. But those people are taking those kind of hints are actually very critical. Even more informal than that, I'm involved with the Medical Student Education Committee, and I put a lot of that kind of content on my social media account. So it's not uncommon that medical students will contact me before AUA, before SUO, and I say yes to every one of those meetings, and we sit and we have coffee, or they'll just come up to me and talk to me. Why? Because I put out the hint that that's the kind of person I'm willing to just chat with and have an informal mentorship discussion, and there's even follow-up sometimes with that. Do you want to be reaching out for a ton of research with somebody who doesn't seem to have a track record of doing research, or working with medical students, or is clearly tied to more like administrative staff within the faculty? Probably not. And I do think it is a bit of reading the room in that regard. And let me tell you, within the AUA, there is just a huge supply of people that are willing to have these different kind of relationships: informal, formal, career guiding, formal research guiding, formal med ed in some regard. So I think it's really about taking those hints.
I think it's so great that you are active on social media and able to make those connections. I'm certainly not as up to facile with those ways of meeting mentees. But for me, this is certainly a regional issue that I have, because at the University of Utah, we're the only residency program in the Intermountain West, which covers Wyoming, Idaho, Montana, all of that. And so we in more rural areas certainly look forward to mentoring regional medical students, because there's medical schools in those areas, but no urology residency training programs. So we really want to meet these people, and we're hoping that they will also train and then stay in the area, because we represent the 47th, 48th, 49th, and like 50th lowest number of urologists per capita in the whole country. So we really want to reach these students, and we want to mentor them, have them understand the regional needs for our area, and then we hope that they'll reach out. So if I run into people on the trail, I'm always like, it's so great to meet you and know that you're in our area. We really want to guide you and advise you, because we know a lot of the areas where there are no home residency programs, and there's a really big need. And like we were mentioning at the beginning of our discussion, there's so many aspects of urology residency that you need some logistical help with, and I certainly see it go sideways if they don't have the right timing for certain steps of the process.
So, Dr. Lenherr, are you finding those mentees from them emailing you at these different programs, yeah, or doing like away rotations?
Both. Sometimes they'll reach out in their second year of medical school if they realize they think they're interested in urology. And also some of these smaller programs might not also be as competitive medical schools for them to get a foot in the door. So they need to get on projects early. They need to understand what the process is and really start to get connected so they can understand how to navigate the match process.
Okay, so it sounds like a couple resources were mentioned. So we have talking about interaction on social media, seeing who seems willing to chat with mentees. And then, of course, using local resources at your medical school, like the research faculty database, and then sending emails to faculty at programs that have a urology department. I know through the AUA's website, they also have a couple of resources, like the Future program, which has the ability for mentees to get one-on-one mentorship with mentors. And that started back in 2023. And since then, they've had meetings at the AUA annual meeting. And then there's also the UpSquad platform, which allows for informal conversations and mentor-mentee interactions. So that's something else that students can be sure to look for.
And just to plug for the Med Student Education Committee panel that happens at AUA every year, there's now been an end to that, where there's always a kind of chit chat afterwards where people will just come out informally, but now there's like a speed mentoring component. It's just another way to meet the faculty who do want to talk to medical students.
Yeah, that's fantastic. Do you all have any other mentorship programs that you're involved in or know of personally that you would encourage students to look into?
I know that, like I mentioned, SWU, the Society of Women in Urology, has a medical student program. Some of the regional AUA sections have programs that, and it mostly also depends on whether or not you're seeking research mentorship or really just exploring the ideas about being a urologist. And then finally, there is Urology Unbound, which has an excellent program to help facilitate traditionally underrepresented minorities in urology to identify mentors. I have some of my residents right now are those mentors, which is really fabulous to see them paying that process back. And then finally, when you're a resident, and I think it's mostly geared toward residents, most of the specialty societies have mentorship programs. So once you're in the process, looking forward to what type of urologist you might want to be, those are great opportunities. And I think that if you really think you are knowing where you want to be in your career, those are also appropriate for medical students. If you know you want to be an oncologist or something like that, you can certainly reach out to those programs earlier than later.
I totally agree, and it may change a little bit from year to year, but there's usually a consistent flow of departments that also have an infrastructure for medical students who want to take a year off, and those students are very much empowered if they're coming from a place that does not have a home program, for instance, and then they associate themselves for a whole year with a program that has a research track for medical students. It changes a little bit year from year, but the key with that is just talking with the people who have matched into urology, who know where people spend some time. Again, I'm just starting off as a faculty, but I do have at least bandwidth to take one medical student each year. I have someone this year. I'll probably just try to keep something like that going. But there are programs out there that take a number of students every year.
You're right. There are several programs that offer summer-long mentorship and research programs to especially those students that need to identify mentors from outside that don't have it at their home medical school programs. And there is just a great number of those across the country. But again, finding mentors to help you match with those different programs is certainly key.
Great. All right. So several programs which are helpful for that. So potentially taking an additional year to get some research integrated into it, and then the medical education committee, and then different societies for subspecialties in urology, if you're thinking that far ahead, and the Society of Women in Urology. All right. So Dr. Weiner, this question is for you. So you have published extensively in the realm of humanities and personal reflection. What is the best way for mentees and mentors to prepare for and actively nurture these long-term relationships?
Yeah, I'm really glad you brought this up. And Dr. Lenherr already started to get at this earlier with one of her comments. I do feel that one of the first things you want to connect with your mentor as a mentee is what are your goals in life? What are your priorities? And I try to get at that right away when I meet new medical students. A lot of times the initial questions are, which program should I even apply to? And I oftentimes ask them, well, what do you care about? What are your priorities? I think very often it doesn't get brought up early enough, but many medical students want to be in a certain part of the country, or they want to be in an urban setting, and avoid all kind of rural or suburban settings. Saying those things up front are absolutely key for a mentor to understand what a mentee's goals are. And so not only do I try to elicit that very early on, I also try to share that with my mentees very early on. So, I have a young child, and we have more kids on the way. I also couldn't make this recording, as you all know. So I have to prioritize my family life, and there are ways that I structure my day-to-day to allow that to happen while maintaining, a research lab and a clinical practice. I share those things with my mentees in my discussions with them, and how I facilitate that and what got me to that, and that is a priority to me. It might not be a priority as much to someone else, or the balance just might be a little bit different. But it is a bit of a two-way street. I want my mentees to share that with me so I can help them reach their goals, or what they've defined as their goals. And I share with my mentees what my goals are and what my priorities are, and what I do to facilitate that.
Yeah, thank you so much for sharing that. Again, I think it's so important just to emphasize that relationship of finding a mentor who you could be genuinely yourself with, because that's just going to be critical in them understanding truly, what your goals are and where you want to go. So thank you so much. Dr. Lenherr, did you have any comments on that?
No, I think that's really true. The idea that you need to follow your heart and identify how to be a real person on the other side of residency and training and real life is very, very important. So I appreciate that Dr. Weiner's doing that.
Yeah, and I actually will make one final comment on that is that it seems also that the trend is in the literature even to publish more on these aspects of training and practice. So I think that that's also facilitating that conversation a lot, which has been really helpful. All right, so Dr. Lenherr, this is a question for you. As a program director, what aspects of the urology residency experience do trainees most benefit from mentorship?
I can speak about our residency mentorship program, which is perhaps structured differently than other programs, but this is something that seems to work for us with a formal mentorship program that we have started. And each resident is paired with a mentor that I kind of pick as somebody to diversify their mentorship circle. So if somebody comes in as an applicant and matches as a resident and their application screams, I want to be an oncologist, I might pair them with a pediatric urologist to really just give them somebody else that they might not cross paths with. They're certainly going to still find the mentorship with the urologic oncologist, but again, trying to follow with the theme that the good mentor can really step out of your path and listen to you and stimulate reflection of your own journey, I think is very important. And so I have some of these residents that are, like I said, totally still going to end up in oncology. And the pediatric urologist or the other type of person is there to just help facilitate that conversation and give them some additional ideas and step out of their way. So I think that that's really a nice aspect of residency. And as you go farther in your training, you're going to end up in your own little circle where you go to your specialty societies and you're not necessarily always talking to these different people outside of the academic world that Dr. Weiner and I live in now. And so it's really nice for my residents, I think, to have this type of diversity in their mentorship.
Yeah, fascinating. Have you had any feedback from the residents on their perspective from those sorts of pairings?
I give them the option to switch at their third out of fifth years. So their junior years, I'm like, just kind of stick with this person for a while. But they never really actually end up leaving that person. They've developed a long-term relationship with them, and it becomes dinners and concerts, and my mentors really take it as a way to again show that real life and help the residents live a little bit aside from just thinking about what their career paths might be. And so I think that it's good long-term relationships for them.
It sounds like it. All right, so we are going to move into the final takeaways. So the last two questions. So I'll start with the first one. Some mentees are hesitant to seek out mentorship or the idea of finding the right mentor. To someone who may feel daunted by this, what is one myth you'd like to debunk about the mentorship process?
I'll start off. I think that I'd like to debunk the idea that we have all the answers. We know how other pathways have turned out for our other mentees and ourselves, but that pathway doesn't have to be replicated. So you're kind of on your own adventure and don't feel like we're necessarily going to tell you all the right answers in the secret code.
Yeah, your own adventure. Very exciting.
No, I completely agree. I think that's a pretty good one. I mean, it takes a well-seasoned mentor like yourself to acknowledge that you do not have all the answers. Even a program director acknowledges she does not have all the answers. So that's really great of you to say. I would say that because I've become so familiar with AUA and the society and many urologists in different facets of practice too, there's a mentor for everybody. And I think that it does take some thinking within your program, outside of your program, engaging with the AUA at the meetings, even other medical students or trainees. If you start to limit who you think is the right mentor in your mind, like it has to be the professor of urology who, wrote a couple book chapters in Campbell, then let me tell you, you're going to run out of people to run to you pretty quickly. I guess I'll just give another shout out to University of Chicago. Another part of why I just felt so engaged with urology pretty early on was that those residents, I don't know what it was, but at the time they just felt they really were helpful to the medical students, and there was something very chummy about that they wanted us all to succeed, and they split up reading our essays, and they would meet with us, after a long day of surgery. And I think back now, I'm like, dang, they really gave up a lot of their time just to chat with me. There are mentors of all kinds within AUA, and I think the limitation is just your imagination with that.
Great. So find mentors everywhere at all levels, and no mentor has all the answers. And the last question we have tonight is, what is the most treasured lesson or advice you've learned from a mentor-mentee relationship?
This is something I've been acknowledging more lately. Again, acknowledging that I'm earlier on in the more structured mentor program since I'm newly faculty. But I would say that one of the most alleviating things that I've learned recently is that I should be learning as much from my mentees as they learn from me. And I know that might sound a little corny, but I really do. I come home from work sometimes and I talk to my wife. She's also an academic surgeon. And I find that most of the time I'm not talking about, some research paper or some crazy, surgery that I just did, but I'm talking to her about my lab or the residents or some medical students I'm working with, and how, there was this challenge and we worked through it and I'm really proud of them, or like they showed me how to take care of this issue. And it made me realize that shouldn't be like the most interesting thing. That should be the expected thing, that when you really facilitate a good relationship with a mentee, you should be learning as much from them as they learn from you.
Listening to you reflect upon that, I have a similar answer, but in a slightly different way. The treasured lesson that I have is the inspiration that I see when my mentors go on their journey and they have that joy. The mentee that I mentioned earlier that was trying to decide between urology and OBGYN, she followed her heart and she went into OBGYN, but then she ended up staying here at our university, and she turns up and she's like, I actually want to go into URPS, which is what I do. And so she still has kind of like looped back around. Not that I want to have her follow in my path, but she's followed her own path, and it feels like this is certainly the right direction that she went. And she's able to take care of patients in her own way. So again, it's that same thing that you reflect on, that joy of seeing those mentees go in their directions and have a really successful career. So it is certainly very fun.
Beautiful. Thank you both so much. Is there any last words that you all wanted to share with the audience tonight on the topic of mentorship?
Lola, I think this is a great conversation, and I really appreciate the questions that you have come up with. And I certainly think that Adam and I have had a little bit of joy in reflecting our own mentorship paths and mentee paths that we've had. So it's been really quite nice. Thank you so much.
I appreciate it. I appreciate you both so much. So thank you, and I hope you all have a great night.
Thank you, Lola.
This has been an AUA News Inside Track podcast. To hear more episodes of this podcast, visit www.auanet.org/podcast.